have a big problem in Europe because kidney disease is the fastest growing cause of death. So we have to do something about it. And this is linked to a second problem. The population at large, the health authorities, they are not really aware of the key function of the kidneys and the consequences of losing kidney health. People think about the kidney disease in relation to dialysis. But the main problem with kidney disease is that you lose the main function of the kidneys, which is a gyrosuppressor function. So this is a technical term that means anti-aging. The kidneys produce molecules, proteins, that delay aging. One of them is called Klotho, the name of a Greek goddess. Unfortunately, Klotho is not measured in the clinic. But we know that when the kidneys are damaged, they have lost the ability to produce Klotho, and your IDH depends on the year you were born, but you have also a biological age. Your body may age faster than your ID says. So when you have kidney injury, you have already lost your ability, your kidneys have lost your ability to delay aging. And how do we know that the kidneys are injured? Well, by a very easy urine test, which is called albuminuria. So to test whether there is albumin in urine. So the population should be aware of their health numbers, including the number for albuminuria. We are used to think, we are familiar with blood pressure, with cholesterol, with glucose, with sugar in the blood, but we don't think about albuminuria. So what's the way ahead? The way ahead is to develop a simple algorithm that summarizes the numbers people should know. The numbers healthcare providers, doctors should get for their patients. And this is very easy to remember because it is A, B, C, D, and E. The A is for albuminuria. We should be familiar with normal albuminuria numbers. We should know our albuminuria number because this is linked to the velocity, to the speed at which we age. We want albuminuria to be very low, so as we have a very long and healthy life. The B is for blood pressure, to detect hypertension. The C is for cholesterol, to detect cardiovascular risk. The D is for diabetes, that is a blood test to assess glucose. And the E is for estimated glomerular filtration rate kidney function. So in summary, the ABCDE allows to diagnose hypertension, hypercholesterolemia, diabetes, and the A for albuminuria includes kidney injury. The E for estimated glomerular filtration rate means kidney function. A and E allow to diagnose and treat very early chronic kidney disease. So if you are able to diagnose chronic kidney disease using the A before kidney function had been lost, you may delay the need for dialysis up to 27 years. And this is associated with a longer lifespan. A young woman on dialysis is life-saving. She will not die within the next few weeks, but her life expectancy is 44 years less than in the general population. Because dialysis does not replace the anti-aging function of the kidneys. It does not produce Klotho. So we have to intervene very early on, because now we have the tools to be able to maintain kidney health. And this means longer life, healthier life.